Good afternoon, everyone. I request principal, vice principal, secretary, our vice president, and Dr. Pick sit on that to start the program. President. I request principal for address this.
Yes, speaker of today's program, Dr. Sneha PT President Praveen Bhadi, Vice Principal of College, Stuti Bolkar, Professor Shabita Bolkar, faculty members and dear students. It is my immense pleasure to welcome you all to this program organized to celebrate International Women's Day. Every year it is celebrated on the 8th March. And this International Women's Day or Women's Day celebration is required because the role of the woman cannot be neglected in the society. If you see our Indian society is male-dominated society. If you trace back the history and find it is dominated by the male in the family, in the society, everywhere. Maybe last 2, 3 or 4, 5 decades you find the women have been given the freedom to choose their career, to take up the job, employment in different sectors, and to be independent, to become independent. You find it now, maybe last 50, 40, 50 years. Earlier, if you see, the woman, only the role of the woman was in the house, looking after the children, cooking the food, serving the family members, taking the care of all the entire family, maintaining the relationship with all the family members, outside the family members, everything the role was played by the woman. Even earlier, even before liberation of the Goa, if you see, even the education were not being, even after before the liberation, even for the male members or the men, it was also difficult, but still then, women were not allowed. Going out of the house is not allowed. But at the time, restrictions were there. Because second law has to be in the house. Doing a job was considered as an inferior right. Even taking an example, participating in the dance competitions or the gathering or maybe the plays, films, etc. was considered inferior, not suitable for the family status, and everything was decided by the male members of the family. There was in the system where there was a joint family system, and the head of the family is called the karta or the main person. Every time you have to take the permission of that person, whoever is the head of the family. Still today also it is existing in certain families, but now there is a change, and one of the change involved the education. Education has made a complete revolution in the society. Women are now equal in par with the men. You will find in every organization, if you see now, that more number of the girls or women than the men. So it is not, we cannot say now it is where only the male is dominating or the female is no. It is not. And second thing very important is that you have to respect. I have considered always that the woman is the backbone of the family. In Kokni I say several times, बाहेर पण नुसतं घरात ना झालं घर पण समान आहे. घरात बाहेर पण राहायचं. Whatever it may be the role, but whether she may be just even the बरी नाती सुद्धा त्याला घरात असा म्हणजे वेगवेगळी जास्त. आणि सगळ्यात महत्त्वाचे म्हणजे we are talking about in my chatting with the doctor regarding the role of the mother. You cannot deny, you cannot neglect, you cannot keep it aside. Mother plays a greater role in the life of the children, whether it is girl or boy. So Women's Day celebration, we have to celebrate. It is not only for one day that we are giving the respect, organizing the program and all those activities, conducting in one day and the rest of the day is Women's Day. No. Even still I was thinking regarding even आमचे देवस्थान जे असतात त्या देवस्थानाच्या महाजन आणि जे मेंबर्स जे आहात सगळं केलं. There is no women in the members in the देवस्थान. आता ऐकून ना देवस्थानात काय ते सभासद केलेले आहेत पण बोलणी करायचे पाहिजे नो. Only the gents in the family, main members in the family. This is tradition has come from the long and we are continuing it. So maybe time will come regarding it to change. It is not yet regarding the everything here now in politics. The 33% reservation is kept for the women. Unfortunate part is that still you find the way is dominating the female members in the panchayat or municipality. Yesterday I read on the mobile the news from Uttarakhand, the female members were elected, 6 members were elected as a punch member, and the swearing ceremony, the male has taken the was involved. So for that then निवडून आलं काय ते सगळ्यांचे काम असताना going on like that. However, but then still because of the reservation, government reservations in the political scenario, the women are getting the social status. And very important one regarding that those who are working is fine. Those who are not working, for them, self-help groups or government schemes for the different government is trying. The central government, state government is trying to uplift the status of the woman, economical status, social status of the woman, because it is very important that when the woman is earning, now if you see in our system of the family, the person who earns the money requires respect. In a family where father or male members, their respect is what because they are earning. Now equally women are also earning, and those who are not earning. So at least for them regarding economic status, you find the government has also become women empowerment. Government has encouraged the self-help groups. So because of the self-help groups, you find that many women are involved in the business and to maintain to be independent and to get the economic status, they are getting the benefit of it. So because of the economic status, social status, everywhere you find women should get it. They should get the respect everywhere. It is not only because very important is that in the family, women take the responsibility, accountability of the family. It is very important. It is not only the authority and autonomy. Now everyone wants freedom, everyone wants authority, everyone wants autonomy. It should not interfere, it should not disturb. But very important is the accountability part, responsibility. There you will find the mother takes the responsibility of the entire family. Wherever it may be whatever the problem is, the mother will be the first, along with the father, mother is equal, and what I mean is the role of the woman in society, in the house, family, everywhere cannot be neglected. So this is on this International Women's Day. I wish all the best for the best wishes for the women and the day, and I welcome the today's guest speaker, Dr. Sneha Kusrikar, who is speaking on the topic which is related to the women. But I wish you all, I welcome you all for this International Women's Day celebration program organized by the PTA in collaboration with the Gender Sensitization.
Since everyone knows, today we are celebrating Women's Day, and Also, hygiene is the most important thing. That's why to speak on this topic, we have a special person, that is Dr. Sneha ma'am. But before starting the session, Sharmila ma'am will give a brief intro about the Dr. Sneha ma'am. Thank you.
Good morning all, and very happy International Women's Day to all. Begin with gratitude as usual. Thank you so much for coming and showing solidarity and with the cause. Here we just have our girl students, but some parents have made it to the list. In fact, the functions resource person has been called by our parent, Ma'am Pooja, with a lot of efforts for us. And this is the first thing I want to say. The second thing is just as I was scrolling, I did not have any speech in mind, but Sir has spoken so beautifully about the role of women. I really appreciate the way he has put this. It is not just about autonomy and authority. It is about what we are. And to that extent, the topic that we have on screen there, if you can see, is very relevant. It is empowered wellness. I do not want to tell you more meanings of empowerment than you know, but the only meaning that I have of empowerment is power which comes from within. It's not the power that we see externally or that power which somebody gives us, but it is the power that comes from within. Do we have that power from within? Do we have that intrinsic power within us, that indomitable spirit which keeps us alive through life's ups and downs? Whether we are raising a family, or whether we are parenting, or whether we are teaching our kids, or whether we are in society, contributing to some cause in society. In all spheres, what is required is your inner power. And that inner power we celebrate today. And that is why International Women's Day becomes very relevant, important to a woman. As far as so many debates about equality, like something which one of the very prominent newspapers had today, which I just rushed through: equal rights, equal opportunity, and equal pay. And then I was thinking, everything or every fight for equality, but what about health? I would not compare the male and the female gender here and say who is more lucky, because in Goa, relatively we are lucky as compared to other women in other states. But even then, I would say, as Dr. Sneha would firmly believe what I'm saying, Goan women are not far away from health issues. They have different kinds of health issues, and she's the best one to tell us this. And with that intention, we called her because she's a person who has extensively worked and she's there in the field herself. Dr. Sneha has first worked in GMC, in Goa Medical College, which is our oldest medical school. She has been a student of that school and she has worked in that school. To have been learning that grade in such a prestigious school, oldest medical school in Asia, is itself an honor. I really regard the medical profession in high esteem, always, all the time. But I myself wanted to be a doctor, but turned out to be the other doctor. And then she has worked extensively during COVID, and you know how difficult the time was, and everybody was avoiding everyone. But doctors had to literally work with the patients, and my own family doctors are not an exception to that. So she has worked extensively there as well. Later on, she has worked in Asilo and she has worked in Urban Health Center. This is a small introduction that she has given about herself, but I would like to know from these few minutes that I've spent with her, and meeting her for the first time, I really found her a very beautiful person. She talks very simply, with no airs about her. She does not show that she is learned, but she has a lot of things to give, and that is why I think she is Ma'am Pooja thought she is a very good resource person for us. I feel very upset and bad of the fact that such programs are looked at as economics department or commerce department or some other program issue of health is something very relevant and equal to all of us. What we are failing to understand is this is a theme which runs through all of us, and therefore we should have been collectively here and we should have sent our girl students, because this is a program which was specifically meant for girl students. तरी असताना आम्ही बिलीव करता की प्रत्येक बाय itself is an institution आणि ती आपली जर फॅमिली चेंज करू शकता तर ती दुसऱ्यांकूय चेंज करू शकता, ती दुसऱ्या खातीर इम्प्रुवमेंट हाडपाक शकता आनी तिचें कॉन्ट्रिब्युशन असंख्य अमाप अशें आसपाक शकता. त्या खातीर एकूच कविता हांव सांगून रोखडेच डॉक्टर स्नेहा कोचरकर मॅडम म्हाका हें करता. ताच्या पयलीं एक हांव सांगूंक सोदता की जेन्ना डॉक्टर आयल्या तिचो टायम खूब म्हत्वाचो आसा पेशंटा कडेन आसता, तो सोडून खंय ती आयिल्ली आसा जरी ती तशें म्हणिना. तरी हांव म्हणटा म्हाका खबर आसा कितली रश आसता ती येता खंयच्याय सरकारी वैद्यकीय हातून. पण तुमी भुरग्यांनी हाज्या मागीर किंवा लेडी टिचरांनी आमच्या डॉक्टराक थोडे प्रश्न विचारून तुमच्या मनान जे आसा जर तुजे कडल्यान डॉक्टराक हें कित्याक खूब ऑनस्टली सगळी फ्रँकली आन्सर दिता आनी बरे तरेन दिता. कोंकणीन दितली तुमच्या खातीर आपलो टॉप जातलो. प्लीज नाम घेवचो कित्याक अशें तरेचो प्रोग्राम we don't know much about what is PCOD and what are the issues that are faced by women. Sometimes we have this confusion with people. So that's why it will bring a lot of clarity if you get to this issue. एकूच ल्हानशी चालू पळयल्यो म्हाका सकाळी दिसल्यो. आमी एकाच मळबा सकयल रावतात. आय डोंट थिंक आय नीड टू ट्रान्सलेट दीस. आमी एकाच हवेन स्वास घेतात. सुर्याची किरणां आमकां समान ऊब दितात. पावसाचे थेंबे आमकां समान भिजयतात. तूं आनी हांव आमकां दिसता ताच्या परसूय चड समान आसा. This is something which every woman is speaking to every woman. And with that, I invite Dr. Sneha Kochekar to deliver the session.
about menstruation and what is the importance of menstrual hygiene, why menstrual hygiene is important. Okay? So first we should have a brief discussion about menstrual hygiene, then PCOD. Okay? So menstrual hygiene. So what is menstrual hygiene? So menstrual hygiene refers to the practices and habits that help women and girls maintain cleanliness and prevent infections during menstruation. The most important point over here is to prevent infections. Most common infection in women is UTI, urinary tract infection. All are aware of this, but urinary tract infection is the most common infection in girls in reproductive age. So what are the benefits of having a good menstrual hygiene? So it reduces the risk of infections and UTI urinary tract infection, and protecting reproductive health and minimizes future infertility. Reproductive health, protecting reproductive health is very important in the reproductive age group. That is from 18 to 30 or 35 years is the reproductive age group. So in this age group, it is very important to maintain a proper hygiene, menstrual hygiene, to prevent the infections and later on to prevent the problems related to fertility. So how we can help women to achieve that proper menstrual hygiene? Increasing access to sanitary products, menstrual hygiene education, improving access to clean water and sanitation. Common types of sanitary products. What are common types of sanitary products? We will use sanitary pads, tampons. These are the latest ones. Tampons, menstrual cups, panty liners, cloth pads, menstrual cups. Menstrual cups are nothing but some girls will be aware of this menstrual cup. A bell-shaped cup made of silicone or latex inserted into the vagina to collect the menstrual blood. So tampons, menstrual cup, we can reuse them. Whereas sanitary pads, panty liners, they are one-time use. So we have to dispose after using it. So this is the panty liner. Panty liner, sanitary napkins, period panty. These are menstrual cups. This is new. Menstrual cup, tampons. These are reusable. You can reuse. Whereas these are disposable ones. Now, key components. Using sanitary pads, tampons or menstrual cups that are clean, absorbable and suitable for individual needs. Changing sanitary products every 4 to 8 hours to prevent leakage and oil. This is very important. Every pad you have to change every 4 to 6 hours, maximum 4 to 8 hours. This is very important to prevent infections. Washing hands with soap and water before and after using sanitary products. Cleaning the genital area with mild soap and water to prevent oil and infection. Disposing sanitary products in a hygienic and environmentally friendly manner. So whenever you are disposing of sanitary pad, make sure you are covering it with a paper and then disposing it, not directly, because you are passing an infection to others. Other people who are dealing with the waste product. The next part talks about PCOD, the actual topic about PCOD. Important topic which is polycystic ovarian syndrome. Introduction part. Polycystic ovarian syndrome is a health condition that affects nearly 12 to 50% of women in the reproductive age group. The exact cause is unknown, but is considered a hormonal problem where the main hormone increase in body leading to multiple problems. It is the most common endocrine disorder in the women of reproductive age group. Now, PCOS. Many people come to us, many patients come to us, man, what is the cause of the disease? Why have got this disease? See, the cause is unknown. Till now we have not got the exact cause why PCOD is happening. But the main reason over here is there is an increase in male hormones, testosterone, androgens. Male hormones are increased in the body of female. What is PCOS? It is a set of symptoms that occur due to excess of male hormones in the ovary. Typically, the ovaries are enlarged. The female has 2 ovaries. So typically the ovaries are enlarged with presence of multiple follicular cysts. Actually the ovary, it doesn't have any cyst over it, but in polycystic ovarian disease we see multiple cysts over the ovary around the cortex. exact cause is not clear. There is an increased risk of type 2 diabetes, blood pressure, high blood pressure, and even heart disease. Now, what are the risk factors or what are the causes? Hormonal imbalance is the most important. Genetics also play a major role over here. Insulin resistance, those who have diabetes can get PCOD in long run. Obesity is very important. Family history and sedentary lifestyle. This is a very obesity and sedentary lifestyle. These are the most important things in PCOD. Now, what are the symptoms of PCOS? What are the symptoms? First one is most important is irregular period. Most of the patients come with this symptom only, kind of period sign or periods irregular. Monthly sign. This is the most important symptom, most common symptom. Then fertility problem, this is later on. After marriage, weight gain and trouble losing weight, very important symptom. Acne on face, chest and neck, excess hair growth may appear on the face. These are the areas where there is excess hair growth. Excess hair growth may appear on the face, cheek, upper lip, chest wall, around the nipples and abdomen. This is called hirsutism. The medical word for this type of hair growth is hirsutism. Hair fall or hair thinning could occur. Hair thinning of the skull can occur. Darkening of the skin of the neck creases, underarm and groin area. This is, I'll show you the picture. So this is the darkening of the skin around the neck, around the nape of the neck. Excess hair growth, hair fall. These are the most common symptoms of PCOS. This in medical term we call it acanthosis nigricans. This condition, the bending of the nape of the neck, this is called as acanthosis nigricans. How is PCOD diagnosed? So what we do after whenever a female patient comes with irregular menses or acne on the face. Okay, so how we diagnose that that patient has got PCOD? First we take medical history. So how long the patient is having irregular menses? Patient is gaining weight. What was the previous weight? Okay, we take the is there any problem losing weight? Acne, please check the levels of acne, mild, moderate, severe. Then we do blood test. Blood test we do sugar, lipid profile, that is cholesterol level, everything we do. Proper profile that we check. As an ultrasound to check the ovaries, to check the status of the ovary, how many cysts are there, multiple cysts. So we have to check the ovaries. Then to diagnose with PCOS, a woman must have 2 out of these 3 diagnostic criteria. Out of these 3, at least 2 should be present to diagnose a woman that she has got PCOD. Out of these 3, okay? Lack of ovulation reflected by irregular menses. So if a patient is having irregular menses, means there is lack of ovulation, anovulation. Hyperandrogenism, there is signs of excessive male hormones in the body. That is just now we have discussed. Hirsutism and acne or increased testosterone levels in blood. What is hyperandrogenism? Means there is signs of excessive male hormones. Excessive male hormones means there is acne, there is hair on the body, and even the darkening of the nape of the neck. These are all the signs of hyperandrogenism. Means there is increased levels of male hormones in the body. Okay, androgens. Polycystic appearance of ultrasound. That is that of ultrasound. This enlarged ovaries with many small cysts may be seen. You can see on the ultrasound. The ovaries will be seen and there will be multiple cysts around the ovaries. That is called polycystic. That's why the word has come polycystic. Poly means multiple cysts. Women with PCOS have difficulty in ovulation and can have problem in conceiving. So if ovulation is not happening, a patient can't become pregnant. And it is the most important. It is more common for overweight. So those who are overweight, cycle continues. It's a vicious cycle. Overweight or ovulation, it is very difficult for the patient to get pregnant. So even the treatment differs. For students like you are reproductive age, who are not married, we tell them lifestyle modification, reduce your weight, healthy lifestyle. For people who are in the who want to conceive, we tell them the line of management is different. We start them on oral contraceptive pills for induction of ovulation. For ovulation to happen, we give them metformin. So the line of treatment differs from patient to patient. Now, how to treat this? Treatment is individualized depending on one main concern and problem area. So people, the students like you all the main problem with PCOD, you all will have symptoms like acne, irregular menses. For starting the line of treatment, the first line of treatment we tell them lose weight. If you are obese, lose weight, lifestyle modification. Eat home cooked meals. Lifestyle modification with weight reduction, regular physical activities, at least 30 minutes of walking is more than enough for you. Physical required to regulate. If the patient is complaining that she is having irregular menses for more than a year, we can start the patient on oral contraceptive pills to regularize the period. But mostly the mainstay of the treatment is exercise, is to reduce weight and to eat a healthy meal. With this only the PCOD symptoms come down. One is trying to become pregnant and is not able to do on their own, one might need to help with medicine. So those who are trying for pregnancy, we start them on ovulation induction medicine like metformin. We tell them, of course, we tell them lifestyle modifications also to reduce weight, to have a healthy diet. Long-term follow-up is needed, and it is important to take medication under strict medical supervision. These OCPs are not available over-the-counter medicine. You all require prescription or doctor's prescription to start the medicine. The medicine is the last thing in the treatment of PCOD. First, I have already mentioned it twice. The main treatment for PCOD is exercise, is dietary modification. The dietary modifications in PCOS. What to eat? Now, this is the main question students ask us. What to eat, man? High fiber food that can help maintain blood sugar levels and lower cholesterol. High fiber food, all your vegetables, fruits, all fiber-rich foods. Great options for high fiber food include fruits, vegetables, whole grains, legumes, nuts and seeds. Nuts and seeds are very helpful in PCOS. There is something called as seed cycling. Seed cycling, after you got your periods, like after 5th day, you have to start eating seeds like flax seeds, then your walnut, dry fruit, walnuts, almonds are very helpful in PCOS. It helps in maintaining the uterine lining and helps regularizing the periods. This is the new latest thing in PCOS. Protein-rich food, chicken, fish. In PCOS, we tell the patient to avoid milk, paneer, dairy products. Why? Because it is seen in dairy products, the acne aggravates. Because it is difficult to lose weight. Okay? So we tell them to avoid dairy food like paneer, milk products. Foods to avoid white bread. White rice is something we can avoid, but we can reduce the quantity of white rice. Maida we can avoid. Carbonated drinks, very harmful. Chocolate, sugary desserts, salty snacks, cakes, processed food, alcohol. See, these things we can ignore 100%. You all can have it once in 15 days, once in a week. We can have it, but it is very difficult to ignore also. We can't ignore, but a small portion. Start again. No. So we can't 100% avoid all these things, but we can make sure that we are having home cooked meals first priority and then once in a week or once in 15 days. So all of who are present here, all the women, I sincerely request them, if you all have any period problem, irregular menses, or you all are having difficulty, the staff over here, difficulty to get pregnant, difficulty to conceive, don't ignore all these problems. Please visit a certified gynecologist and get tested. So any questions you all have, I have kept very crisp and very short my presentation, so we can spend some time on questions and you can ask me some questions if you have any queries. Not only about PCOD or menstrual hygiene, any questions you all can ask me are related to women's health, no issue. important question. Many people are very scared about PCOD, that they think PCOD is a condition that can lead to infertility. No, you can't get pregnant with PCOD, nothing like that. You can manage your symptoms well. Only thing with PCOD, there is a problem with ovulation. A woman might not ovulate every month. So ovulation is required to get pregnant, right? We have to release that egg for the sperm to make to get pregnant. So the main problem is with PCOD is anovulation. There is lack of ovulation. For that ovulation to happen, the first thing you have to maintain is your weight, lifestyle modification. These are the two important things. If you reduce your weight, automatically ovulation will happen. If you are overweight, see BMI, it is body mass index. The body mass index should be less than 25. There is a formula for which you have to calculate. But remember, the body mass index should be less than 25. That means you are not obese. You are in a healthy weight criteria. So you can get pregnant with PCOD. Nothing to worry. There are medications also for even with weight management, even with proper lifestyle. We give the couple a chance of around 6 months. We tell the patient that 6 months you can try on your own. You have to do exercise, reduce weight. If one after 6 months or even after 1 year, the patient is not able to conceive, that is start medication. That is meant for me to induce ovulation. But with at least 90 patients, they become pregnant if they follow strictly their diet, they reduce weight, they get pregnant. No issues like that. PCOD is a condition that lead to infertility. Nothing like that. It's a myth. Okay. Now, next question: how to manage heavy bleeding and painful cramps? Is I required to take tablets for cramps? Now, heavy bleeding. This is another topic. Okay, heavy bleeding. So, heavy bleeding. So it depends how many pads you have to change daily. If you have to change more than 4-5 pads daily, then you are bleeding heavily. You have to check your hemoglobin. Get yourself checked for anemia. This is very important. Okay. Here around 50 people are here. So I think around 10 must be the hemoglobin will be less than 12. We are not aware. I request every woman present over here to check their hemoglobin levels. For women, the hemoglobin level should be around at least 12, about 12, 13, 14. So that tiredness is there, weakness is there, jam and these all are symptoms of anemia. Okay, so in women know that anemia goes unnoticed. We never know we check our hemoglobin. So I request everyone to at least once a year or every 6 months get your hemoglobin checked. Okay, so this heavy bleeding can lead to anemia, and that anemia can lead to weakness, tiredness, body ache. Okay, so you have to check why this heavy bleeding is happening. So see, changing 3 pads a day, like first 2 days you get heavy bleeding, but it depends. How many pads you have to change? 4 pads, 5 pads, that means you are bleeding heavily. So get yourself checked for that. Okay? And painful cramps. See, in this age group now, like around 18 to 23, 24, these cramps are normal. Okay, so you all don't have to take, every time you don't have to pop up painkillers. You all can use hot water fermentation. If the pain is too much, like you all can't bear, then you can take a painkiller for it. No issues with cramps. These are very common things, you have to deal with it. Only that heavy bleeding, you have to see how many pads you all are changing per day, how many pads you need like per day. If it is more than 5 pads, at least you all are bleeding heavily. Okay, so the full 5 days, the blood loss shouldn't be more than 80 ml. So, but you all can calculate how much you all are bleeding. So, by looking at the number of pads, you all will come to know. Okay, so daily 3 pads, 4 pads, okay, more than 4 pads, 5 pads, that means you all are bleeding heavily. You have to go yourself and check, maybe your hemoglobin. So that heavy bleeding can lead to anemia. Okay, then if anemia is there, then we do an ultrasound. There's a lot of steps involved in this. Is it possible to manage your skin despite having PCOD? Now see, all patients will not have acne in PCOD. There are some patients will have acne, some patients will not have acne. So, you all can manage your own skin. You all can manage your own, like taking proper care of your diet, your exercise, and your skin part will take care of itself. Okay, so don't need to worry about your skin. You all have to worry about your diet. Very, very important. Mostly, you students are not concentrating on your basics. Diet, exercise, at least 30 minutes walking per day is very important. That 30 minutes can help you in the long run. cured or is it a lifelong condition? See, PCOD, we can't cure 100%. So cyst will remain in your ovary. The thing we can do is we can reduce the symptoms of PCOD by doing exercise, by lifestyle modification. We can reduce the symptoms. We can't cure 100% PCOD. Then PCOD will stay with you. But in some patients I have seen with proper exercise, those who have maintained a strict diet, that even the 100 there is resolvement of the cyst, 100% resolvement of the cyst. But some patients they don't take things seriously. For 1 month they'll do properly, another next month again so the cyst will recur again. So that condition will stay with you, but nothing to worry about that. Okay, you all have to take proper care of the symptoms. We have to reduce the symptoms. Okay, we have to first focus on the weight. Every doctor, whenever you all go to the gynecologist, you want to conceive, or you all are having acne, you all are having irregular periods, the first thing doctor will tell you to reduce weight. It's the most important thing in PCOD. Is it something to worry about if you are borderline to get PCOD? Ready to get this question? Borderline and PCOD. PCOD is PCOD. There's nothing borderline. PCOD. If you are in doubt, if you are in doubt, get your sonography. See, if you are getting your periods regularly, you all don't have any symptoms, you all are not at a risk of getting PCOD. Okay. Then if you are like doubtful, ASAP and then you can get the ultrasound done to check for the status of the ovary. Can you do any more questions? Thyroid. So, thyroid is very common condition. With the hypothyroid, TSH development, very common condition. This irregular menses, irregular menses is not only PCOD. They have to rule out other conditions as well. Whenever I say now irregular menses, this is only PCOD. Okay, there are many other diagnoses as well. Thyroid can also lead to irregular menses, then fertility problems, inability to conceive. Okay, so for thyroid, if you all have very important thyroid is heavy. If your mother is having thyroid problem, if your grandmother is having thyroid problem, so you are at a risk of getting a thyroid problem. Okay, 2 to 3% risk is there. So you have to check your thyroid levels every once in a year to get yourself checked. Okay, and for thyroid, maintaining a proper thyroid level in your body, you all have to see if there is an intake of proper iodinized salt in your diet. Okay, iodinized salt is very important. Now see, there are many salts available in the market. Himalayan pink rock salt, Tata salt light. But see, after so much processing, you know that iodine level decreases. So the normal white salt which we are having from ages, that is important. Okay, that salt is enough because that salt will give you a proper iodine content in your body, because that iodine we won't get from anything else except fish. Little bit. Salt is important in your diet. Okay. Similarly for thyroid is another topic. We speak that on thyroid again. So we can speak about thyroid, hypothyroid. It's a very vast topic. There's other parts also. So any questions related to this you all can ask me. Yes. Yeah, it is completely normal. Around 14th or 15th day ovulation happens. If your cycle is normal, regularly you get on 14th, 15th, like from 7th to 15th day, you might experience mild cramps, okay, mild spotting. It is completely normal. Nothing have to worry. That means your body is producing egg. That's what I said. See, white rice you all can have, okay, but along with white rice, start having salad, because with salad, the carbohydrate, the level, the sugar spike, it decreases with salad. Every endocrinologist, diabetes specialist, they always tell us with rice, with fish curry, always try to have a bowl of salad, which helps to reduce the sugar spike. See, white rice is a staple food in a Goan meal. We can't include white rice completely. You can have brown rice, No issue, but the other things are also very important. The other things which I have mentioned, white bread and carbonated drinks, soft drinks, these are also important. These we have every other day. So these things have to be stopped, especially in this age group. They get scared. Guards are cancer and polycystic, this cyst related to polycystic are nothing but water-filled cysts. Okay, udgacho gati type म्हणतात water-filled cyst. Okay, this we come to know on ultrasound. Okay, आणि दुसरी समज गाठ असलेली, it is a differentiation असा त्याचा. कारण हे water-filled cyst. Okay, this can be reversed. हे water cyst असतात या reverse करू शकतात. But malignancy जर आली की असतात, malignancy symptoms खूप different जातात. पॉलिसिस्टिकाचे सिम्पटम्स खूप डिफरंट असतात. मॅलिग्नन्सी समजा कॅन्सर असलं, ट्यूमर असलं, त्याचं केअर खूप डिफरंट असतात. मॅलिग्नन्सी तुम्ही कशी जाऊ शकता, यू कॅन गेट पिरियड्स एव्हरी 10 days, हेवी ब्लिडिंग. म्हणजे कितीतरी बाबा युट्रसात काहीतरी गाठ झाला की परत त्रास करतात, परत मेन्सेस जातात. फॉर मॅलिग्नन्सी द सिम्पटम्स आर डिफरंट. की पॉलिसिस्टिक इट इज कम्प्लिटली क्लिअरली रिटन ऑन द अल्ट्रासाउंड ऑफ these are polycystic multiple follicular cysts, nothing to worry. It's a follicular cyst only, nothing malignancy. It's a water-filled cyst कशाने. गाठ म्हणजे कशी गाठ नाही आम्ही आता म्हणतात की पिशवेत गाठ झालं म्हणजे फायब्रॉइड. कॉमन मध्ये आम्ही लोकांना सांगतो की पिशवेत गाठ असं ऑपरेशन करचे पडतले. तर इज अ फायब्रॉइड. इज ऑल्सो नॉन मॅलिग्नंट. फायब्रॉइड सुद्धा मॅलिग्नंट आहे आणि ते खूप काढून टेस्टिंग करतात. फायब्रॉइड 98% इज नॉन मॅलिग्नंट. सो फायब्रॉइड सुद्धा खूप जण असू शकतात. जर फायब्रॉइड धुपाची गरज ना. Okay, only thing that fibroid is bigger in size. What also? Pregnancy conceived of problem जातात. परत ब्लीडिंग जातात. किती जातात? झाल्या आपल्याला फायब्रॉइड काढतात. स्मॉल फायब्रोस नथिंग टू वरी. इवन यू कॅन गेट प्रेग्नंट विथ फायब्रॉइड. ओके, सो स्पेशल फायब्रॉइड मी कंप्लेंट तुम्ही करू नका की यू आर विल नॉट गेट प्रेग्नंट किंवा किती प्रॉब्लेम असं नसतात. ओके, देयर आर डिफरंट साइजेस ऑफ फायब्रॉइड असतो. बिग साइज मोर दॅन 10 सेंटीमीटर वी नीड टू ऑपरेट. लेस दॅन 2 to 3 सेंटीमीटर असलेला ऑपरेट करण्याची गरज पडणार. Your hemoglobin is 10. Because symptoms काय ना. Okay, if you don't have any symptoms, tiredness ना, गोळ्या येतात, थोड्या पेशंटला गोळ्या येतात, टायर्डनेस येतात, वीकनेस येतात, पेन पडतात, नर्वनेस येतात, असे जर सिम्पटम्स काय ना, 10 hemoglobin पेशंट रिझल्ट आणि hemoglobin 10 असा. You all can manage your diet, but त्याची टाइम लिमिटेड असं अप टू 3 months तुमका चान्स देऊ शकता. तुम्ही पेशंटला सिरियसली म्हणता ना नका करू. तर असे पेशंट घेतात, मुलं बघा त्यांना नाका असतात. नका डॉक्टर मुलं नका, आम्ही करत आम्ही फोर्स करू शकत नाही. मॅनी लॉज डॉक्टर्स आर गेटिंग स्कूड फॉर इट. आम्ही पेशंटाच्या वगैरे पहिले आम्ही घेतली फॉर्स, आता आम्हाला तसे दुपार मिळेना. पेशंट ना म्हणता आम्ही नाव म्हणता. पेशंट जर ऐकलं तर आम्ही काय करू शकता त्याच्यामध्ये, कारण आम्ही बोलू शकतो. सो पेशंट म्हणतात की ना आपण करतो की आम्ही त्या म्हणता, पण बाबा तुझे परत 3 महिन्यात तू हिमोग्लोबिन चेक कर. आणि तुला समज सिम्पटम्स काय ना, ओके सिम्पटम्सचा तुला परत म्हणतात की स्टार्ट ऑन आयर्न टॅबलेट अँड बी कॉम्प्लेक्स. And that iron and B complex, whoever is taking over the iron and B complex, so very important thing is iron and B complex tablet should never be taken together. Because त्याचे दोघांचे मेकॅनिझम असे असतात की वांगडा घेतलेले दोघं एकमेकांचे हँडल करतात. ओके, सो मेनी डॉक्टर्स दे गिव्ह फॉर लो हिमोग्लोबिन दे गिव्ह आयर्न and B complex. एकदा केन्ना विसरता डॉक्टर सांगपाक पावना की बाबा हिमोग्लोबिन टॅबलेट वांगडा केन्ना घेऊ नका. Okay, if you are taking iron tablet in the morning, you have to take the B complex in the afternoon or at night, but never together. B complex also calcium. never together. Okay, because that mechanism is such that it hampers the effectivity of it works against each other, and iron and B complex. So you all have to take it separately. There should be at least 6 hours difference. Yeah, calcium and B complex you all can take, but iron and calcium, iron and B complex you all have to take separately. मला त्यांना योगा करण्याचं त्यांचं इफेक्टिव्ह काय आहे. आणि दुसरी गोष्ट म्हटलं हिमोग्लोबिन, जेव्हा we start patient on iron tablet, रोज एक महिन्यामध्ये त्या पेशंटाने हिमोग्लोबिन चेक करतं, हिमोग्लोबिन वाढणार, कसं डॉक्टर हिमोग्लोबिनच वाढणार, नेव्हर डू लाईक दॅट. बिकॉज आमची बॉडीची येस कशी असता मेकॅनिझम कशी असता की इट टेक्स ॲटलीस्ट 3 months फॉर हिमोग्लोबिन टू राईज बाय 1%. परत दिवसांनी वस्तू एक महिन्याची वस्तू ब्लड टेस्ट तुम्हाला 10 तासात 10.2 तासात 10.3 तासात डॉक्टर चेंज केलं काहीच फरक पडत नाही. ॲटलीस्ट वेट फॉर 3 months टू चेक युअर हिमोग्लोबिन. ऑल्सो युअर शुगर HbA1c याला हव्या HbA1c. ओके, आता HbA1c असताना आम्ही किती सांगतात 3 monthsने HbA1c करेल. बिकॉज तो मेकॅनिझम कसं असतं की 3 महिन्यांनी त्याचा रिपोर्ट येतो. एव्हरी मंथ HbA1c फॉर 600-700. पेशंट was every month and does HbA1c 7 तास 8 तास डॉक्टर सांगतो गुळीवर लागता. इट मेक्स नो सेन्स डूइंग HbA1c एव्हरी मंथ. ओके, HbA1c करता, फास्टिंग करता, पोस्ट प्रेंडियल करता एव्हरी मंथ. ओके, बट HbA1c शुड बी डन एव्हरी 3 months. प्रोटोकॉलच तसं असा. For HbA1c, for hemoglobin, you have to check every 3 months or once in 6 months. Okay? Any other questions? Please, I touch upon that topic. It is very important topic. You have to because they are thyroid कमी करतात. कॅबेज, कॉलीफ्लावर हे कसे इंटेक कमी करतात, स्पेशली कॅबेज. थायरॉइडचे सिम्पटम्स खूप वेग आसा. अशें न्ही की एकूच सिम्पटम आसा. इरेग्युलर मेन्सेस आसा, मागीर एनलार्जमेंट ऑफ युअर गॉयटर, एनलार्जमेंट ऑफ युअर ग्लँड, नेक ग्लँड तो आसा. इरेग्युलर वेट गेन सुद्धा आसा थायरॉइड. डिफिकल्टी टू कन्सीव. सो जेन्ना आमचे पेशंट येता आमी एक वर्स जालें आमी ट्राय करता टू गेट प्रेग्नंट. आमकां जाय सो आमी हे सगळे टेस्ट करून दिता. फ्रॉम डायबिटीज, फ्रॉम लिपिड प्रोफाइल टू थायरॉइड टू सोनोग्राफी फॉर टू चेक फॉर पॉलिसिस्टिक ओव्हरी डिसीज. सो एवरीथिंग वी give them to the to do that. See, दोन तरेचे हायपरथायरॉइडिझम आणि हायपो म्हणजे कमी जाता, हायपर म्हणजे वाढता. केसेस येतात स्पेशली तो हायपोथायरॉइडिझम. केसेस लेवलच्या हे जाता थायरॉइड लेवल कमी जाता, पण त्यांना आम्ही कॅबेज म्हणटा अशी कमी खायला म्हणटा. म्हणजे रेस्ट्रिक्टेड इंटेक ऑफ कॅबेज. That's related to that cause is unknown. Why is main hormone? We know in PCOD main hormones increase, but कित्याक लागून exact cause and there are some causes that we list केले पळय. Obesity, मागीर म्हणजे genetics also play important role. म्हणजे आमच्या भारताचे जर obesity आसा, some menstrual diseases prevalent in your family. ते सगळे genetics, मागीर obesity all are related to this increase in main hormones. But actual cause is that statement is also not clear. It is not clear. When problem happens in the ovary, the male hormones increase in the ovary. The ovaries only secrete the male hormones. So that's why that related circuit, your obesity, your increased weight, obesity, sedentary lifestyle, then your lifestyle modification, all combined they affect to this problem. All combined they cause this problem. Up to 70 or 60 weeks. Diabetes, hypertension, there we talk about hypertensive patient, what BP is more than 140. Normal BP is 120/80. So 130, 120, 130 you consider normal and we don't start them on tablet. The BP is more than 140. What we tell the patient is restricted salt intake. This salt, Jordan Masha, come in Otherwise, for that patient, you can remove that portion and you can keep separate. For others, you can add that quantity of salt, whatever you are using in daily food. Okay, you have to reduce the salt intake. Restricted salt diet is the term. Regarding menses, menstruation.
Students who
Any family problem?
ask freely, don't worry.
Any family issue?
And why these students don't come? But to ask such things.
See, in this age group, what is people think PCOD will cause infertility. Pregnant women problems. What may you actually PCOD will not cause infertility for the letter to be विचार काढू शकतो. PCOD will not cause infertility. Only thing it is in your head. You have to manage your own symptoms by doing lifestyle modifications and weight management. Okay?
Patient who has low BP, having a high heart rate is normal. Higher heart rate, pulse rate, is it normal?
See, another topic. Low BP. What is the BP of the
It is usually it is on lower end, at 110 by 85.
Why that is okay? When we say low BP, when it is less than 100 and 90 by 60, 80 by 60, that time we call low BP. But up to 110, it is okay. It is not a low BP. If the heart rate is increasing, heart rate is more than like 75, 80, and 50.
From 80 it has touched 95. There is such a
Considering the patient's heart rate is less than
yes, it is much better.
So we have to investigate that patient. We have to investigate that patient. It is okay. Thyroid function is yeah. Thyroid is the heart rate increases. Thyroid stimulation could be a decision. Most important. Heart rate. Vagina, to protect the head of the vagina. Okay? See that white discharge will be more during the ovulation days. Meaning your uterus is preparing to get yourself pregnant. So तशें ती physiology आसा. Okay? Summers, if you have to change your underwear, like frequent change of underwear, then you have to investigate. But normal white discharge you are getting panty liners for comfort. There's nothing to worry about white discharge. Especially bypass age more than 35 years, they come to us. Even a B complex works for them. Monday to Thursday. We don't give anything else. It is not effective by because even I have mentioned soap also you have to use mild soap. Actually soap is not actually आपली physiologist कशी असता की it has to there should be acidic pH. आता एक डिशवॉश आयला किती गरज ना प्लेन वॉटर the normal soap which you are using so with that also you can wash. No need of using dishwash. Because marketing not required. एक thing is cleansing also to keep the area dry. Prevent any infection. And change and measure and the most important point is change your measure. Change your scientific pad every 4 to 6 hours. Maximum is 8 hours. खूप जण आपल्याला बाहेर गरज पडतात कॅल्शियम आणि विटॅमिन्स घेतात बट इफ यू आर हॅव्हिंग देयर आर नो सिम्पटम्स जॉइंट पेन थोडी वेळा मोस्ट इम्पॉर्टंट जॉइंट पेन सो वी गिव कॅल्शियम decreasing levels of estrogen after post-menopause, they are getting calcium deficiency. So with calcium, it helps for them. Not compulsory. You can take it. So good. It is okay. I understand that. There are many what flushes are AC चालू तरी बायलेबल what flushes गर्दी जाता weakness येता body ache येता these are all signs of menopause. Now this is the main thing to explain.
Please ask the this. You want me to close the you have like a close like the same angle is. Please tell the those students if they have any queries. Because now there is no time to check. Please do that because they don't show. No, sir. Now I
So, urinary tract infection. What are the symptoms of urinary tract infection? Symptoms are frequent micturition. Patient संतर्कावर मूत्र करता, उसका त्रास करता जळजळता. These are clear symptoms of having urinary tract infection. So, first thing, मुलगी आताची उदक पिना. Says that you all should take water at least 3 to 4 liters. Very important for women. Okay, 3 to 4 liters. उदक पिल्यामुळे urine concentrated जाता. urine concentrate झाल्यावर bacteria formation जाता. So in that you will get urinary tract infection. So to flush out all the bacteria, all the toxin, you have to drink water. Okay, and if you are having the short course of treatment is available for 5 days. That the infection is. Main thing is intake of water. Especially summer is coming, you have to take at least 3 to 4 liters of water. So many cases come to urinary tract infection in these days. Thank you very much.
Dr. It was a very nice session. One thing I felt we should not looking for women. We are blessed with a girl child. Also in this session we should have parents we should have for parents also. At least chocolates those all the carbohydrate drinks. बापूस आमच्या भुरग्यांक दिता. Also what we do like आमी आमच्या स्पाउजाकूय सेम थिंग whatever they ask at least आमचे मातशें पॉकेट मनी मातशें कमी जातलें. Next time आमी फादर प्रोग्राम करूया. कित्याक आमी चलयेचेर आमी खूब लाभ करतात जाय ते मागून दितात बट एटलीस्ट वी कॅन हेल्दी फूड टू देम रायट इट्स मोस्ट इम्पॉर्टंट. Just 1 minute we president because Q&A just went out. It was a very nice session, Mama. Yeah, because everyone was asking questions. That's why everyone was very interested. Yeah. Ma'am, you want to speak something? Yeah. one moment. Because I'm waiting for people president. Before that, I would like to thank Dr. Sneha ma'am taking I think we have just informed 15 days before only. Okay, just taking this, with a short notice. And also I would like to thank our principal, vice principal, VP, president, all secretary, and all my colleagues, and also my students. Without them, this program would be not successful. Okay, thank you everyone. And before winding up, I would like to just give a moment to our today's resource person. I will request PTA president, okay, Varghese, just give our I will request Pooja ma'am. I will request Pooja ma'am to give a resource person thank you letter.
Please give a big round of applause.
Because of Pooja ma'am, thank you. Thank you everyone. I request all the students, before leaving, please collect the snacks. Okay, thank you.